wanted to do this out here because so many, I don't know of anybody who has not been touched by what we're about to discuss. It is a huge exclusive announcement that could revolutionize the fight against cancer. I had the privilege of sitting down earlier with Nike co-founder and chairman Phil Knight and Dr. Brian Druker. He is the director of Oregon Health and Science University's Knight Cancer Institute, who had some very, very good news to share with everyone. I don't think I look forward to seeing two people more than you right now. Thank you so much for being here.
Great to be here.
You and your wonderful wife, Penny, pledged $500 million to your Cancer Institute with the stipulation that it also had to raise a matching $500 million in 2 years' time. It's been less than that. You are here. Just do it. Give us the big announcement.
We did it. OHSU got the other $500 million for a total of $1 billion to contribute to cancer. But let me.
Did you hear that, people? $1 billion.
It's a fabulous moment for OHSU, for people fighting cancer, and for the state of Oregon. And let me say this, for us to make this announcement on a program hosted by a person who so successfully fought cancer and became the symbol of hope for so many cancer victims, it's really a special and almost poetic moment for me, and we thank you.
That means so much to me, Phil. I'm welling up because there's some people here in the studio who are fighting cancer right now. And when they hear this, it means so much. What does this mean to you, doctor?
Well, first of all, we're incredibly grateful to the Knight family for inspiring this momentum. But now we can turn our full focus on attacking cancer as aggressively as it comes after us with this $1 billion investment.
You and Penny, you could put your money anywhere. Why is this so important to you and Penny?
Well, I met Dr. Druker about 10 years ago and made the first pledge 7 years ago. And it was probably shortly after that, it was about 3 blocks from this very building when I was at an Advertising Hall of Fame dinner. And a woman walked across the room and she said, "Your Dr. Druker saved my son's life." Her 12-year-old son was diagnosed as terminal cancer. And by the time that dinner happened, the child was in remission and leading an active life.
You like results. Yeah, you do. You
absolutely. He's a champion. That he hides it well with his modesty. I used to call it false modesty, but he really is modest. But he's a genius, and what he's done with the contribution up at OHSU is truly remarkable. They have 40 new cancer research doctors up there, and they're on the move, and they're going to win.
That's your new slogan too. Yeah. We will win. You were saying, Doctor, earlier that this is kind of like being a triathlete, that the first leg, raising the money, is complete, but there are other legs left.
So now we have to take the knowledge of what we know about cancer and use that to detect it earlier, when it's more curable, when it's more easy to treat, and save people from having to go through chemotherapy or radiation or other debilitating treatments that you know so well, Robin. So we're setting the stage for moving from advanced cancer to early detection and ultimately to prevention.
And what does this mean to you personally? How has this touched you?
My wife was 5 years old when her mother died of breast cancer. I lost my father to leukemia, and 2 years ago I lost a brother to prostate cancer. But every day I go to clinic and I have patients who were told they had months to live, and because of the drug we developed, Gleevec, for leukemia called chronic myeloid leukemia, some of them are 15, 16 years out. So I can see the impact we can make by attacking cancer at its very roots. We want to do that for everybody.
And do you have a personal connection as well, Phil?
Sure, I think everybody has a connection to cancer. My father died of leukemia, and a beloved aunt died of breast cancer. So cancer's touched everybody.
It is one of those things that it does not discriminate. I can't remember anyone saying it hasn't touched them in some sort of way.
Absolutely.
So what do you want to do now?
Well, for me, it's getting back to work. We want to go after cancer as aggressively as it comes after us.
We will win.
Yes.
All right. Phil, Dr. Druker, thank you very much. Once again, $1 billion being raised for the fight against cancer.
Thank you.
And I love how everybody out here was watching as well. I mean, it has the potential, I mean, you know with me, it has the potential to be a real game changer. And I love how they said it's wonderful about early detection and how a lot has been focused on that, but it's about prevention. It's about how we stop it at the very beginning, and that is what they're going to do there in trying to bring about real change.
Such a huge number.
Billion. It is considered, if not one of the biggest single contributions in the fight against cancer.
Historic.
Yeah, it really is. So thank you.
Thank you,
Thank you,
Phil.
Phil. Thank you, Dr. Druker.